and with the state's finances now so weakened, are just completely impossible. So I think that there is just so much that suggests that the national health insurance proposals are themselves divorced from the needs of the health system at this point and what it needs, and itself as a kind of idealized health system reform. It's just not realizable in the practical world as we experience it today.
Yes. Now, what I find quite interesting is the age-old saying which you have used in your comment, where you say, if you have all your eggs in one basket. Now, this is absolutely important because you also speak about a single gatekeeper for activities. Here we're talking about distribution and procurement, and we know what has happened with COVID-19, our experience in terms of corruption and procurement corruption, and also this whole move surrounding things like central procurement. And that, I think, is absolutely important when one needs to take into account looking at, what the NHI may achieve, and if we have to learn by what we've experienced with COVID-19.
Yeah, I mean, so there's always a problem with, in designing systems to work effectively, you have to make decisions between what you centralize and what you decentralize. And one of the big risks when you centralize things you shouldn't is that you end up putting all your eggs in one basket. Secondly, you end up concentrating power in the hands of a very small number of people, which if you don't have effective governance, which we don't have in South Africa, then it creates the exposure to abuse. And we've seen this, like Eskom is a classic example of putting all your eggs in one basket for energy production and distribution. And that's an incredibly dangerous thing to do if they start making mistakes, which are often related to governance and accountability, that then everybody has to sit and grin and bear. So what you do in designing a system is you very carefully look at how you reticulate what you centralize and what you decentralize, how power is basically distributed to get the most efficient system against a number of objectives achieved. So what the NHI proposals involve is just centralizing everything because they think, well, that will be more efficient. Well, we're seeing it's not efficient. We're seeing government couldn't negotiate vaccines efficiently. They couldn't design a rollout process for vaccinations efficiently. And I'm just talking about vaccinations, which is our most critical COVID intervention at this point. They basically fouled it up. And they've said, well, we should be doing it all. We should be centrally procuring vaccines and centrally distributing them. And the problem now is that if they mess up, we don't get vaccines that are distributed efficiently and effectively and timelessly.
Well, it certainly sounds ominous because if they mess up, the entire country is messed up. And this is the reason why public and private sector cooperation is so important. And I'm sure that COVID-19 has taught us some wonderful lessons going forward in terms of management of NHI. And we know that, they are talking of it becoming law by 2022. So we've got time to sit back, to reflect, to ponder, to rethink what, the plan was as far as NHI is concerned and whether it is going to work or it's not going to work.
I think the bill that was actually submitted to Parliament is in fact was very poorly drafted and thought through. And so already it required a huge amount of work to get it to a state where it can be implemented and have some sort of practical effect. This is quite aside from the fact that it involved a pretty weak institutional model, which is unlikely to solve any of the problems that we're seeing at the moment in South Africa. And the fiscal position is just completely impossible to resolve. So I think that I think the fiscal position has pretty much put a line through any possible feasible implementation of any sense for the national health insurance proposals. We're just not in a position to waste money on sort of essentially political vanity projects at this stage.
Just finally, Professor van der Heever, looking at the private sector and that cooperation is absolutely critical, it's vital, and looking at the private sector in terms of adding value adding value and making absolutely sure that whatever is proposed as far as NHI is concerned, what sort of role can the private sector play?
The private sector is a very critical asset. As itself, markets themselves are institutions for the delivery of goods and services. And if there are weaknesses in that market, then you regulate them so that they're more effective. But the private sector is a pivotal part of our overall universal health coverage strategy and model. We have to embrace it and make sure that it is able to operate efficiently in the public interest. And that's something that that government has failed to do to this point as well. And rather it has spent time saying, well, we want to basically suck up the private sector. We want to duplicate what it does. And the government's not capable of doing that. And as a consequence, we've had nearly 15 years in which no proper regulation of the private health system has occurred. And that gap is huge. It means that the private sector can't serve a public purpose effectively.
Well, Professor Alex van der Heever, I know obviously you are rushing and taking time out of your busy schedule with us to be with us here on Salam Media this morning on News and Views. We thank you. We do appreciate your time. Please take care.
Thank you.
Professor Alex van der Heever, Chair in the field of Social Security Systems, Administration and Management Studies at the Wits School of Governance this morning, talking about the COVID-19 experience and the proposed NHI, National Health Insurance. We are heading towards 9 o'clock for the news. And when we come back, we'll be having our Jummah inspiration this morning. And this morning, Maulana Ahmed Muhammadi will be providing the Jummah administration. من عرب ومن عجم مولاي صل وسلم دائما ابدا على حبيبك خير الخلق كلهم مولاي صل وسلم دائما ابدا على حبيبك خير